Bob? Thursdays, again, if you're no stranger to the broadcast here, we do this pretty much every Thursday if you're new. We like to bring folks in from the medical community, just give a little segment there to talk about your health. We have Eddie Sejo in from New Hanover Regional Medical Center today. We're going to talk about a region-wide medication take-back. It's going to go on this Saturday, so let's start right there. When you talk medication take-back, first thing I think is expired medication, but that may not always be the case. You may have some things that you just don't need it anymore at home. This is probably the safest way to get rid of this medication.
Sure. So we take expired medications maybe you don't need anymore, that you have antibiotics that you didn't finish, or you have a pain medication you don't need. We take any of those medications, pet medications maybe your pet didn't finish, anything that you might have, creams, tablets, ointments, anything there, we will take back.
Saturday, give us a breakdown of the hours, the locations where folks can do this.
So it's going to be Saturday, April 28th from 10 a.m. to 2 p.m. We are actually in 15 different locations across 6 counties in southeastern North Carolina. So that ranges from the medical mall, where it's been consistently. We have areas in Duplin County, out in Surf City, all the way to out in Brunswick County. So there are many locations. It's on the New Hanover website, as well as posted all around town.
For folks like myself who probably for years, when my medicine's bad but I don't need it, I turn to the toilet, I dump, flush. Explain to folks at home, explain to folks at home why this is just such a poor idea.
Sure, well, absolutely. We know we have some water concerns down here, so we want to make sure that everyone has an opportunity to get rid of those medications in a safe and effective manner that's not in our waterway, that's not thrown away in our trash system. So we have this event. It's twice a year. April 28th is our current event, but we also have permanent medication drop boxes across the entire area. So you can go on New Hanover's website under the community activities section, and there's actually a location for all these permanent drop boxes. So if you can't make it Saturday, we encourage you not to continue to do that while waiting for October, but to go to one of those permanent drop boxes and let them go there.
I was going to say, these events, I compare these to the shred-a-thons. Sure. When folks get a chance to get rid of their materials, when they happen, they become so big because it's, number one, it's such a good service, but I think also because folks are concerned about privacy with medication, because you can also turn the pill bottle over. You toss these things out in the trash, there's labels, things like that. How popular have these become for you that the implementation of these boxes around the area is now an everyday occurrence? Sure.
We at New Hanover have implemented these about a year ago, and we're turning those boxes about once a month, so we're getting a good amount. This event has been very popular. In October, we collected nearly 10,000 pounds of medications to get off the streets here. So expect a lot more as we continue to expand from 9 locations in October to 15 locations in April.
And again, the good thing with this, no questions asked. You walk in with whatever you've got, turn it over, say, I don't need it, I want it disposed of in a proper way. Again, it'll be this Saturday, running
from 10 a.m. to 2 p.m. We'll collect any medications you have, as well as any sharps that you might have. All locations will be collecting sharps, so needles, anything like that you want to get rid of as well.
Yep, and you can find all that information. It's up and running on our sister station's website, as well as on the New Hanover Regional Medical website. Appreciate the time.
Pleasure, sir. Thank you.
Go Buckeyes.
Go Buckeyes.
Should we say that? We're both from Ohio. Gabe, he's in as well. We're back after this.